Am I ready? Oh, I'm on. Okay. Hi. How are you all? Well, this is Senior Moments, and I am Millie, and this is KUAW, Kansas City Global Radio Station. Knowledge, understanding, and wisdom. And uh, if you want to call or have anything to talk about that you want to talk to me about, you can call us at um, 816-599-6893. And you can listen to us audio on kuaw.org. And if you want to email us, leave us comments or questions, there is KUAW985 at gmail.com. And you can like us on Facebook and share. And that is KUAW-LPFM 98.5. So, we're on YouTube, Twitter, uh, and all those things. I forget the other one, but we are on a lot of different ways. So just tune in, and you can get us different ways. So uh, today, uh, I'm going to talk about the coronavirus, and the main thing I wanted to talk about was how it's affecting the Black community. We, the ethnicity and immunity, uh, why some communities of color have been hit so much harder by the coronavirus. And the coronavirus had affect every aspect of American life. And but while each of us has felt some level of impact, um, one fact is inescapable across the country. African American and Hispanics and Latino has been hit pretty hard with this virus. Now, like for instance, in Louisiana, there is Black people made up less than 33% of the population, but um, the percentage is 56% of death. That's that's way up. And in Chicago, it's likewise. So there is a lot of different cities that the coronavirus has really hit hard, and I guess that's why they fight so hard for the fight so hard because they want to let you know and currently letting you know how many that are being tested and hospitalized. Now, studies continue, but initially, no research has emerged to confirm or rule out genetics role in COVID-19 severity and super susceptibility. There isn't anything per SE about race, as in Black or African American or ethnicity, like uh, Hispanics and Latino. Uh, they We all put in a high risk for infection, and they are just letting us know and trying to uh, uh, give us medication and different things that will help us to curb this these different things that, well, different medications. They just trying to see what will help you to get out of the hospital if you are in the hospital. And they want you to, if you are tested positive and you're not really sick, they want you to stay in your house at least for 14 days, 10 to 14 days. I forget. I know they used to say 14. Seem like here lately they've been saying 10, but just stay indoors if you are tested positive. And why infected rate are higher? The according to the CDC, they place where people live, learn, work, and play affect a wide range of health risks and outcome. And that means that the job, school, housing, they define an individual uh, also his and hers health risk. Another issue is health disparity, which mean that the different in as the access to Medicare, quality foods, and other aspect of health lifestyle. There's two factors goes along ways towards explaining how the virus get a firm toehold to in certain communities. Okay, now housing is density and social distancing have a critical has been critical in limiting the space of the virus. But in low income urban populations, um, a distance of 6 feet can be a luxury. Asking people who live in very dense household or public housing or to quarantine and isolate in is an incredible challenge for them. Uh, so it goes again against how those buildings can construct and goes against the nature of their families, and that is easily why the virus spread so vigorously in those communities. So you look at um, uh, how many people are in, and I guess that, well, that's what they're saying is, when they say distances, you live in a real small 3 bedroom apartment. It's not like living in a 3 bedroom house. So when you have to uh, and it depends on how many people have to be in that smaller space, and probably don't wear masks. Everybody just they goes, and if they're working, that's even more things they have to worry about. They go out and work, and then they come back in a enclosed rooms that they really don't have a lot of room to distance. So that is one of the things that they have a problem with is the housing, and then you have employment. Bottom line is it's impossible for many Black and Latino people to self quarantine is because they have to go to work, and a lot of their jobs are are in with the public. You have to work with the public, and you can wear masks, and a lot of times you still can get, because like at a lot of the grocery stores and a lot of the departments, well, the what you call discount stores, they have all this protection around you, but sometimes, and you wear your mask, sometimes that is not helpful. But they do the best they can, but they still have to work and take care of their families. And then a lot of times you just can't stay at home. You just have to go to work and do what you have to do. And also, it's the lack of quality food. Now, a lot of times where they live is poor diet, and the immune system is not like it should be, and it's a lot of health risks across the board. And the problem twofold. First they have stores in they not a lot of stores, but the stores that are in the neighborhood don't have the fresh vegetables. They have to eat food that's processed or in cans or in bags. So, how much fresh food are available to buy? And sometimes you have that available, but that's something that you don't like. A lot of people don't like to eat vegetables, so it's hard to get uh, kids, or if you don't eat vegetables, how are you going to get your children to eat vegetables? But that's some of the things that we have to look at and see how we can improve that. And also, they the lack of, now that was three of the things that we have that help us to be more prevalent getting the coronavirus, because of the housing, employment. We have to work and be out there with everyone else. That some people wear the mask and some don't, and the lack of the important foods that you can get to stay healthy. And sometimes it's by choice that we don't eat healthy, because that's not what we know to do. A lot of us, now not everybody. Now, the lack of testing. I think here in Kansas City, it has gotten better with the testing of the coronavirus. They have free places that you can go. And if you watch the news in the mornings or the day before, they may tell you where they're going to be testing. And all you have to do is call ahead before you go, and uh, put your name on the list and see if you can get tested. And especially if you are going, if you're working and you are out in the public, uh, then you need to go and get tested so you know what to do. Uh, and please wash your hands. Uh, all the things that you're supposed to do to prevent getting that. So testing is, and they say that well, we'll go back. Those go back to employment jobs in under under underrepresented community are less likely to come with health insurance. Okay. Oh, that's health insurance, and many people remain uninsured despite of the Affordable Care Act. In many cases, getting tested for COVID-19 require a primary care doctor recommendation to transportation to a testing site. Oh, I didn't know that. That is now everybody don't have primary doctors. Some people, if they don't have insurance, how they gonna have primary doctors? And so it's catch 22 there. And so a lot of urban communities have limited access to testing. But hmm, I well, the site and they have problem even if they know where the test is going to be. They might have a problem if they don't have transportation. So it's a lot of different things that I didn't realize that why the people may not get tested, and they won't know that they're sick until they really get sick and then have to go to the hospital, and that really makes it bad because they don't get the preventive help. Like sometimes you get tested where you might not have no side effects or nothing that's going on, no, and then they say, well, you do have it, then you're going to start taking care of yourself or try to do whatever the doctor tell you to do to not be, so you won't have to, because everybody don't go to the hospital. We have a lot of people that recover from this uh, coronavirus, but uh, that is some of the things. And now, why death rates are higher? Well, immediate goal after the coronavirus infection is to prevent disease progression. Okay, that's what I was just thinking. And underlying health issues. Oh, when you have underlying health issues, that is also important that you get tested earlier so that they can try to work on you before you really get sick. So uh, we have a lot of things uh, that we need to know and need to take care of, and we have different things like blood pressure, high blood pressure, diabetes. There's other diseases that kidneys and diseases, heart disease. So you definitely want to try and get tested earlier. You know, if you think you've been around someone that may have this coronavirus, then get tested. Go and see if you can get help. Uh, uh, get tested. That's the main thing. Is I can't say it enough. And the following factor are found at greater level in many communities of color and all increase uh, one vulnerability to coronavirus. So there is a combination of age, underlying medical conditions, and poverty. It just so many things that we have to look at. So uh, just be aware and try to do a lot of the things, especially if you have been out like they was doing all the protesting and stuff. If you go out there protesting and get tested, uh, all because being in groups, that's what can cause a lot of people to uh, get the coronavirus. Also, if um, uh, you going out to the protesters, is a lot of them wear masks and a lot don't, and so please just wear your mask. And well, the main thing is when you of age, in older age, and have all these underlying conditions, you should stay at home and save lives. Help to stop this coronavirus. Stay at home as much as you can. Keep a safe distance. Wash your hands. Cover your cough. And if you're sick, call ahead and stay and let them tell you what you need to do if you have the temperature and any of the symptoms with the coronavirus. Now, also, we talked about the age, obesity. They talk about obesity people. They overweight, and and a lot of them have underlying conditions. So you want to do the same as I was saying about the age. Just go and get tested, or if you feel like that's what you need to do, or stay at home and 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 do all the things you need to do to keep from getting this coronavirus. Hypertension, said that, and high blood clot risk. Okay, when you have this coronavirus, they did talk about that. That is, you can have the blood clots, and that's a risk to your health. So, just make sure you get tested so you won't have to worry about uh, being in intensive care with all these different challenges that you would have to worry about. And uh, I would like to take a quick break, and we can come back, and I will be closing out after we get back. This is Millie with Senior Moments. Okay, I'm back, and this is Millie with Senior Moments. Um, okay, I was talking about the coronavirus. Now, the coronavirus, COVID-19, whichever one you want to uh, talk about. So, if you are out there working, have to be with the public. Hopefully, when you go to work, they check your temperature before you go in. I know a lot of the only place I go is a church. Well, I only went there once. I haven't uh, I don't go a lot of places. I stay at home. And when I do go out, I try to protect myself. But I know when I went to church, they had the thermometer. They check your temperature, and you wear your mask. Everybody in there have their mask on, and then I also had on gloves. Uh, I like to wear my gloves when I'm out in public and touching stuff. And so it depends on the person. Everybody don't care about doing all that, and everybody, you know, body's different. I know I have a lot of underlying conditions, so I don't want to open myself up for that. So it depends on the person. Some people think they can get through that, and that's fine. Uh, well, I say that's fine, but that's not what how I feel. I really feel like everybody should wear their mask, but I don't have no control over that. I only can control myself. So uh, now I uh, also probably I'm thinking about talking about policing maybe on my next segment next week, but I have to see what I want to talk about next week on the show. But I just want to let everybody know that um, it is time for you to sign up, register, register to vote. I asked everybody to do that, and also fill out your census. You can go online and make that real short. Oh, I don't have Cheryl's card with me, and yes, fill out your census card and make sure you vote. And if you can, take souls to the poll. Anybody need a ride to the poll? And you know they need one, take them to the poll so they can vote. I will do that also. And now it is time for me to go. The time is go by so fast. And so before I leave, I'm going to read this prayer that I read every week until something happened in this United States that can stop me from reading it. Uh, Lord, I pray for our nation's leaders and ask that you would give them the ability to make wise decisions, to govern with integrity, and to accomplish their tasks in ways that build up our nation. And may they bring glory and honor to your name as they serve our country. May God bless America. And thank you for listening today. See you next week.
You have been listening to Senior Moments on KUAW Radio, Kansas City's global community radio station. Be sure to tune in every Tuesday at 2 p.m. for Senior Moments with Millie. Have a great day.